whether or not depressive and anxious disorders that often result in SSRI and antidepressant use already have pre-existing requisites on dreams. Is there a possibility that someone with PTSD or schizophrenia may already have more vivid and possibly violent dreams? Yes, but for depressive, suicidal, and anxiety disorders, violence in dreams has often increased heavily post-medication use.
I guess I started taking them in elementary school because I had really bad phobias, like to the point, there were weather phobias, and to the point where it was just like, that was my whole life.
I guess when I was in 8th grade, I don't know, I just like felt like super depressed and I didn't want to talk to my mom about it. So I went to like therapy, and then my therapist prescribed me on Prozac.
In 2007, the Journal of Clinical Sleep Medicine constructed a case report about a 50-year-old man with, quote, no evidence of neurodegenerative diseases of any type, and only suffering from a 10-year history of RBD. These symptoms of RBD arose when he first started taking an SSRI, and stopped when the medication stopped. They occurred when he was taking both fluoxetine, or Prozac, and paroxetine, or Paxil. He showed at a 2-year follow-up that there were no further symptoms of RBD. According to the Michael J. Fox Foundation for Parkinson's Research, symptoms of REM behavior disorder include physical reactions to their dreams and vocalizations, like how a dog may be running or barking in their sleep, confusion and disorientation, daytime sleepiness, and experiencing and remembering deeply intense dreams. In some cases, RBD can be, quote, a risk factor for Parkinson's and other brain diseases. Not everyone with RBD gets Parkinson's disease, but in some people, RBD is one of the earliest symptoms of Parkinson's, end quote. Cleveland Clinic best summarizes this phenomenon of tying medicine to RBD, stating that while idiopathic or naturally occurring RBD is more common than drug-induced RBD, medications are the significant cause of increasing rates of RBD with younger patients. For example, adults aged 60 and older have roughly 60% of idiopathic RBD cases, while the remaining 40% are linked to an underlying neurological disorder such as Parkinson's. Drug-induced RBD cases are caused by a wide range of antidepressants, including SSRIs, SNRIs, and TCAs that trigger RBD symptoms because they increase serotonin and dopamine levels, with serotonin being the factor that often suppresses muscle movement during REM sleep, and dopamine receptors affecting the paralysis that occurs during REM sleep. Basically, quote, antidepressants used to treat depression are liable to cause more sleep disturbances, end quote, that with RBD can become dangerous and more vivid.
Right now, I'm on duloxetine. I've been taking that for like 4 or 5 years. I'm on the higher end of doses, I will say. Like I'm high on the doses, and then I also kind of go between 2 doses. But I've done, oh gosh, I can't even remember. I've done like Prozac, I think.
I think I started off on 10 milligrams of Prozac. Now I'm on 30. And I take 15 milligrams of Adderall whenever I like need to like focus on like school or like driving. And I take Janelle Fee birth control. And then just like over the counter like vitamins so that I don't like keel over.
Looking specifically at SSRIs such as Prozac, the National Library of Medicine conducted a study that examined the dream effects of paroxetine and fluvoxamine to, quote, test an important potential method for probing the relationship between REM sleep neurobiology and dreaming in humans, end quote. For the specific study, they had 14 volunteers, 4 males and 10 females, with the average age being approximately 27 years old and a range of 22 to 39-year-olds, with no neuropsychiatric symptoms, to take a 31-day home-based study that consisted of 7 days of no drugs, followed by 19 days of either 100 milligrams fluvoxamine, similar to Prozac, or 20 milligrams paroxetine, similar to Paxil, taken in divided morning and evening doses, finally followed by 5 days of, quote, acute discontinuation, end quote. Every morning, subjects would write down dream reports and scale the emotions and general characteristics of the dream. 3 judges, which I have no way how they determined it, but they got 3 judges, then score the dream reports on the bizarreness, movement, and the amount of descriptive nouns used. So basically some equally bizarre categories, but then again, how do you rank vividness? The Nightcap Ambulatory Sleep Monitor, aka fancy REM sleep recorder, measured the frequency of waves during REM sleep to compare vivid dreams. Strangely, dream length and their bizarreness increased during the 5 days of downtime, and the intensity of dreams increased during the 19 days of med use and 5 days of downtime. Patients often struggled to get back into REM sleep during treatment, and it became far more intense after they stopped med use. The study concluded that, quote, the decrease in dream frequency during SSRI treatment may reflect serotonergic REM suppression, while the augmented report length and bizarreness during acute SSRI discontinuation may reflect cholinergic rebound from serotonergic suppression, end quote. AKA, SSRIs suppress REM sleep where most dreaming occurs.
I can't say that I remember a ton of what my dreams were like on Prozac, if I'm gonna be honest.
How are your dreams now?
Mostly, I'll say they're pretty normal, or pretty normal. Usually they're like the ones that you just kind of forget, but I will say, like, I do have very vivid, very intense stress dreams sometimes. Like, they will happen, like, multiple days in a row. And they're just, like, they'll wake me up, and it's really random. Not necessarily nightmares, because they're not scary. They're just very stressful.
Sometimes I have dreams I have a penis, and I wake up sad because I don't have one. Is this normal? I had this dream that I had a little brother, and I didn't remember him being born. Like, I just woke up one day and he was, like, there, and he was 5, and I was like, who's this kid? A dream that this person with a country accent came. I was, like, working a register for some reason, and somebody came up and was like, is the Chinese sandwich okay? There was, like, a little clown goblin running around in this kitchen, and this grandma is, like, cooking, and she picks it up and throws him into the frying pan, and he literally burns to death, and he's, like, shrieking. I had a dream there was a zombie apocalypse, but Amish people were immune. Like, the zombies just didn't care that the Amish people were there, and they just kind of just, like, walked around with their horses and didn't do anything, and everybody else was scared. I had a dream that I drank a tea and sipped gasoline, blacked out, and J-Lo got so pissed at me. And you know Diary of a Wimpy Kid?
Yeah.
I had a dream where Greg and his dad did a hit and run, but there's a giant pizza decal on the top of their car, so they got caught immediately. There was one where, like, time kept shifting, and, like, there was this, like, murderer who was, like, a fisherman in the 1700s, and he keeps, like, trying to get me. And I keep finding, like, frozen fish in the freezer, and I'm like, oh my god.
Lots of them take place in, like, academic settings. Well, it's not necessarily, like, at school. Like, I remember one that was, like, really notable because it had, like, basically everyone I know in it. It was, like, last year, and I was on this, like, island for research with all of my friends, and one of my close friends and I, we were trying to do this research in this group with other people, and it was almost like in a children's museum, but we kept on, like, fucking it up, and I just remember being, like, so fucking stressed.
Nightmares really only occur in REM sleep. Many studies show that antidepressants, including citalopram, prolong REM sleep latency and suppress REM sleep time, and are therefore expected to reduce or suppress nightmares. There have been case reports citing other antidepressants, mirtazapine and bupropion, for example, to both cause nightmares. Both are also known to increase REM sleep. There have additionally been reports citing venlafaxine and fluoxetine causing nightmares. Sertraline can make dreams more intense. Intake and even more withdrawal of SSRIs or SNRIs seem to intensify dreaming, which can be experienced in a lot of different ways. The best way to look at it is that vivid dreams are associated with a high percentage of REM sleep, whereas non-vivid dreams don't really show an association with deep REM sleep at all. The connection between vivid dreams and high REM may aid in advancing understanding between REM abnormalities in sleep and neuropsychiatric disorders that involve very vivid dreams, but a lot of that is limited by medication use, especially in younger patients.
That's, like, part of the reason why I have so much trouble sleeping is, like, I don't know why. My brain just knows what's gonna, like, fuck me up. Like, and it just, like, shows it to me. Like, I don't even remember what was happening when I had this dream, but, like, my ex-boyfriend and I still, like, really liked him. And I don't even know, like, I was in charge of making sure that he didn't die or something. And, like, he, like, fell and, like, cracked his head open. and then he just like melted into sand in my hands. It was like horrible. That one's never happened again, but like I'm waking up after that one, I was like, oh my god. Like, and then after that, like, there was one night where like we got drunk at like a friend's house, and like I literally couldn't fall asleep, so I was like, oh my, he's gonna die. Dude, I had a dream where I was getting like dragged through a cornfield with some guy with no face. The things that like characters in my life do in my dreams are like, what are you, why is this happening? Like, I don't know. Dreams like do stuff that, like, I frequently get dreams about when I was like assaulted, and just like reliving that, and then just my brain finds different ways to like twist it and make it like even worse for me. And it's like, why are you I live up here, you know, like we're a part of the same machine, okay? You don't have to do this. I think when I wake up from a dream, I'm just like, oh my god, what was that? Like, and before, like I said, I don't really remember any of my dreams before taking Prozac, and I've also been taking it since like 8th grade. So it's just like, I don't know, this is like normal now. I'm just like, yeah, my dreams are weird.
The relationship between drug-induced and idiopathic RBD is extremely complex, and some research suggests that medications may not be the root cause, but instead, quote, unmask an underlying milder RBD in individuals who are already on the trajectory toward neurodegeneration. Basically, any younger patient taking an SSRI who is struggling with dreaming could just be struggling with that medication and its effects on their body, or the medication could be used to show that this person might have early onset Parkinson's in the future. This idea of unmasking is supported by several findings. For example, studies have shown that patients with antidepressant-associated RBD or drug-induced RBD often still show markers for neurodegenerative diseases, like an impaired sense of smell. These same patients also tend to have a lower risk of eventually developing a full neurodegenerative disease compared to those who have purely idiopathic RBD. This suggests that the medication reveals a latent condition rather than creating a new one. In patients under 50, drug use and narcolepsy are often the most common causes of RBD. And for much younger patients, research suggests that a strong link between early onset psychiatric disorders and a higher likelihood of developing RBD could later be followed by neurodegeneration.